Hello, welcome everyone. I am Dr. Nupur and we have with us Dr. Mansi Chauhan. She is a breast surgeon working at 𝐶𝐾 as well as from Onco Clinic in Gurugram. So we are here to discuss with you what are the risk factors related to breast cancer. Before we come to that, let us understand what is a risk factor. Anything that increases your chance of getting certain disease is your risk factor. There are women who don't have any risk factor but still develop breast cancer. But still, there are risk factors which can be reduced, which can be controlled, and that can help you lead a healthier life and more meaningful life. So, let us discuss with Dr. Mansi that what are those risk factors which you cannot modify and others which can be modified. So, modifiable and non-modifiable risk factors. First and foremost is the age. So, Dr. Mansi, does age affect your risk of breast cancer?
So what was known about age as a risk factor was that with increasing age, the chances of getting breast cancer increases. But this is not absolutely true in current circumstances because we do see very younger women who are getting breast cancer, especially in our countries, and these cancers are really aggressive in as compared to those in older age groups. So there is no cutoff of any age which we can say that below this breast cancer cannot happen. So which is actually a myth because many women think that it's only after 40 because we say that we should do mammography only after 40, so maybe we are not at all at risk for getting breast cancer, but that's not true. So there's no cutoff value that below this age that you cannot have breast cancer. So every woman after 18 years of age should be really aware of what breast cancer is and what should be done and how to check them.
Yeah, so we are here today to make you more breast aware. And being a woman itself also increases your risk of breast cancer. Now, the second point is that do genetic mutations play a role as far as breast cancer is concerned?
Yes, so genetic mutations, that is faulty genes, do play a role, but this is in very less, that is almost 15 to 20% of cases that happen because of mutation in certain genes, and these tumors are hereditary or familial kinds of tumors. But this is very rare, only in 15 to 20%. So the majority has absolutely no significant family history or any faulty genes, which are the reasons for having breast cancer.
Mhm. So, when we are talking about genetics, the next thing that comes to mind is family history. So, what is the role of family history as far as breast cancer risk is concerned?
Yeah, so just because of these faulty genes, they run in the family, and hence they have a significant family history, uh, which predisposes others to have breast cancer. That's why a significant family history, as in uh, patients who suffer from breast cancer or ovarian cancers in your family, which are your blood relatives or in your first circle, first cousins, or your maternal or paternal grandmothers. So this history becomes significant in terms of your risk. And if any of these have been tested positive for the genetic mutation, the genes which are most commonly known as BRCA1, BRCA1 or 2, then you should also get tested for these gene mutation, but only under the supervision of oncologist and genetic counselor.
Mhm. So, very important to know your family history. There comes the role of family history and especially your first degree relatives. Dr. Mansi,
Yes.
I was also going through literature in which said that males who have breast cancer also increase women's risk. So, any male in your family who has breast cancer and you are a close relative, you also need to keep a check because that also increases a woman's risk of breast cancer. Uh, so,
Yes, so exactly, ma'am. So male breast cancer is very rare, But if anybody has a history of male breast cancer in the family, they should definitely get checked for the BRCA1 and 2 gene mutation. And as we know that this genes being transferred to a son or a daughter is has a 50% chance. So it is not something which is running only in female population. So these faulty genes can be transferred to the males in the family as well.
Okay. So, what about obstetric history or reproductive and menstrual history as far as women are concerned?
Yeah, so the most important, in fact, risk factors in terms of breast cancer is the hormonal history or the hormonal milieu of a female body. So mainly estrogen and progesterone, these are the two hormones, and their complex interplay at different stages and ages of life play an important role. So estrogen is kind of a growth promoting kind of a hormone, and its prolonged exposure increases the risk of breast cancer. Hence, what we say that early menarche, that is early starting age of menses, and a late menopause exposes the female body to a lot of estrogen and hence increases the chances of breast cancer. And on the other hand, progesterone, which is a protective hormone, so timely pregnancy and breastfeeding, these increases the progesterone level in female's body and hence has a protective effect against breast cancer.
So very rightly put. So women who have menarche less than 12 years and who have menopause after 55 years are at more risk. So they need to be vigilant and go for regular screenings. Now, once we have discussed the menstrual and reproductive history, another thing about menopausal women is some women still need hormone replacement therapy, that is HRT. So when we are talking about hormones, how does HRT influence the risk of breast cancer?
So there have been studies on millions of females, and it was concluded that females who receive HRT, that is hormone replacement therapy after menopause, that is external hormones, if you're taking after menopause, had increased chances of getting breast cancer as compared to those who were not taking those replacement hormone replacement therapy. Hence, it is very important to be highly selective about patients who will actually require or should be given HRT, because this definitely increases the risk of breast cancer, especially in postmenopausal women.
So, talking about hormones, even oral contraceptive combination pills sometimes increase the risk, but not all pills will lead to breast cancer. There is a common myth that taking oral contraceptive pills will lead to breast cancer. There have been various studies, but still the studies are ongoing to exactly establish whether OCPs will increase your risk of breast cancer or not. So coming to next point,
Right,
if
ma'am.
there is a personal history of breast cancer, how does it influence the future risk?
Yeah, so the personal history of breast cancer, it can be categorized into a recurrence of that tumor which she had earlier, or developing another tumor in another breast, which is of different variety. So both the risks are high in patients who have had breast cancer in the past, and hence a stringent follow-up protocol and surveillance and tests and everything is mandatory for all these patients.
So talking about radiotherapy, we have spoken about hormonal therapy. So now women who have been exposed to radiotherapy in the chest area has been also found to increase the risk of breast cancer. So how often should they go for a checkup, or should they be just more vigilant and keep a check? What is the right protocol?
Yeah. Yes, so this is a very rare scenario, but a very important one, that if female has received any radiation for any kind of childhood tumors to the chest area, then they have increased tendency of getting breast cancer, and hence they have to undergo a high risk screening kind of protocol, and they have to be really vigilant about developing breast cancer as compared to the general population.
Yeah. So now we have discussed the factors which we cannot modify. That is your age, being a woman, your past history, your personal history, your family history, your own reproductive history, whether you have breastfed or not. So, Dr. Mansi, let us discuss factors which we can modify and which are under control. So, first and foremost is physical activity. So, what would you like to say?
Yeah, so it might be very cliched, but physical activity prevents you from many disorders, heart diseases, and uh, bone and joint health and whatnot. But it definitely prevents you against breast cancer as well. So a regular physical activity, 30 minutes in a day, at least for 5 times in a week, has been shown to have a those who follow a proper physical activity kind of schedule have reduced his risk of breast cancer as compared to those who are obese or are do not have any kind of physical activities.
Yeah, so rightly put, it will also help you reduce risk of hypertension, diabetes, heart disease, stroke. So many other non-communicable diseases are also importantly taken care of. And we have also known that obesity or being overweight increases the risk.
Yes,
So
so
how does
obesity.
that happen? Yeah.
So obesity or being overweight, basically the fat content in the female's body affects the hormonal status of the females. So these reduce metabolism and increase hormones, which is produced in the peripheral fat. It definitely affects the risk for breast cancer. And there have been studies which have shown that obesity is now an important risk factor for breast cancer. So maintaining a healthy weight and indulging into regular physical activities is important and a very modifiable risk factor which you can do easily.
Yeah. So women who are married, who are planning pregnancy late, or who are not even planning pregnancy, or maybe going for surrogacy, or have a fertility problem, so they also have been found to have increased risk in various studies. So we also encourage that you should plan conception around 30 years of age. If you delay beyond 30, if you don't breastfeed, so your risk increases. Also, there are studies which say nulliparous women also have more risk. At the same time, what about the current scenario where a lot of people drink and smoke? So, alcohol and smoking, how does it affect the risk of cancer?
Yeah, so these are called the lifestyle factors, which includes alcohol, consumption of alcohol, smoking, and very stressful life, obesity, lack of physical activity. All these lifestyle factors definitely affect the risk of getting breast cancer in females. And especially consumption of alcohol with smoking, it increases the risk. And these are all proven by studies that they have an effect on the risk for getting breast cancer, as well as eating a lot of saturated fatty acids and not a balanced diet, which includes fibers and antioxidants and fruits and vegetables. So this might sound very easy to understand, but this definitely has effect on breast cancer. So these are small little things which can be practiced in life, but they.
Thank you, Dr. Mansi, for highlighting such important things which are under control and which we should be aware of at the same time. So, I think next time we should discuss that what are the preventive measures which can be taken to prevent risk factor other than we many a times we talk about what is screening, how to do screening, how to diagnose early. We still know there is no vaccine available, but yes, let us focus on prevention because preventive health plays an important role. It helps in early diagnosis. So people will come to you at an earlier stage, so treatment becomes easier, prognosis is better, quality of life is better, and it is close to being preventable when you detect very early. Is that right, Dr. Mansi?
Very rightly said, ma'am. Breast cancer is the most common cancer in women across the globe. And when detected at an early stage, the cure rates, the survival rates are as high as 95, 97%, which is very high. So it is a very much treatable disease and manageable disease, but if detected at an early stage. And this can only happen when people are aware about this disease and they undergo their routine checkups and screenings. That is how it can be detected at a very early stage and hence treated right. So, as ma'am.
So thank you so much, Dr. Mansi. We will meet again soon.